We'll get started, Ollie. Good morning, everybody. I'm Jake. I'm part of the Education Work and Skills team here at Greater Manchester Combined Authority. It's an absolute pleasure for me to be able to lead us into this morning's session. So this morning we're going to be talking about healthcare and social care careers across Greater Manchester. So health and social care is one of our key 7 MBAC sector gateways that we've got across the city region. Essentially, it looks at how we can identify gateways that you as young people sat in the classroom today can start working and plotting towards making a career in the near future. These are all areas where we've got an increased demand for talent and skills across the city region, but also where we're seeing the most growth as well. Today's session, we're going to be covering and celebrating, more importantly as well, the NHS's birthday. So it's the 78th birthday of the NHS this year. It's a massive milestone, but also just to highlight as well that the NHS is one of the largest employers within Greater Manchester. So in Greater Manchester, there's about 224,000 people that work across the broader health and social care sector, but the NHS is one of the largest employers. The top 3 in-demand careers and occupations that we have found and done research on are: we are looking for more social workers, home care assistants and general nurses. The average salary starting out in this sector is going to be about £31,000, although this is likely to be slightly lower when you're starting out, when you're in training or working part-time, and you're going to hear more about that today. And just a quick fun fact for you: so we've got Manchester Oxford Roads corridor. That is the key place. That is the catalyzer almost of where science and healthcare innovation is sort of coming from within Greater Manchester. It's just minutes away from Europe's largest cancer hospital, which is the Christie NHS Foundation Trust. So that's some key piece of labour market information that we've got to really settle you into today's session. It's a pleasure of me to introduce Martin Halliwell, who's the Industry Placement Coordinator for Greater Manchester. Martin has been with the NHS for about 5 years now, and we'll talk to you about a wealth of information, different career routes, different events to get involved in, and how you can see yourself within the health and social care sector. So Martin, it's a pleasure. It's coming over to you. Thank you.
Thanks, Jake. Appreciate it. So yeah, folks, good morning. My name is Martin Halliwell, Industry Placement Coordinator across Greater Manchester. So I work in a role to encourage young people into the NHS and, well, the wider health and social care kind of sector as a whole. I wanted to kind of just give you a bit of insight into the various levels of career, the different careers that we have in the NHS, kind of roots in as well, you know, what you can do. So I wanted to give you practical advice, things that you could go away from today's session and do just to get into that role. I didn't want to just showcase a number of careers and say there's lots of careers that exist, because I just appreciate that doesn't really give you much to work with. So NHS careers, yeah, more than just doctors and nurses. So we will go into a little bit more on kind of the roots in, you know, the different roles that there are, and yeah, what you can do from today's session. So yeah, next slide, please. Folks, I fully appreciate you can't talk to me, you can't shout it, I'm not in the classroom with you. But yeah, roles within the NHS. Now, I've given you 2 on the first slide, doctors and nurses, but what else can you think of? And just ponder it for a moment. You know, if you're in a group, you know, you have a chat with the person at the side of you, you know, maybe just think about, you know, the different roles that exist within health and social care. So yeah, doctors and nurses don't count. You can't have those 2. I need more than just doctors and nurses. I'll just leave that for a few seconds while you have to think about it. Again, maybe think about those family members, you know, think about family members who work in social care, maybe, you know, those people that you see on the school run or whatever, you know, they've got the uniform on, you know, what is it they do? Next slide, please, Ali. So yeah, here are some examples. So you may have some of these, you may have thought of some of these, you may know, you know, some better ones, some more specific examples. Clinical and non-clinical roles. So these are the typical areas that we divide things up into: very broad, clinical, non-clinical. I'm non-clinical. You know, I work in an office. I kind of work 9 to 5. I don't really see patients apart from when I'm directing them around the hospital. But typically, yeah, I'm not patient facing. So I work in a kind of admin and clerical role. That's the the area that I work in. But yeah, nurses, doctors, paramedics, radiographers, physiotherapists, pharmacists, healthcare support worker, midwife, mental health worker. These are all people that are patient facing, and they're typically clinical roles. It's not a definitive list. There's far more than that. There's consultants, and there's dentists. So many different roles that sit in that clinical area. Behind the scenes, so yeah, I'm very much behind the scenes, but yeah, me and my colleagues that are non-clinical, we've got like receptionists, medical records officers, cleaners, porters, catering assistants, IT support technician. Huge amount of opportunities for careers in digital within the NHS. Estates maintenance worker. So these are typically people that sort of would be, I don't know, they would be involved in a trade elsewhere. So you've got plumbers, electricians, you've got gas maintenance operatives. You've got lots of different kind of trades within that kind of estates and maintenance area. Finance assistant. So if you're big into accounting or kind of legal, those kind of things live generally together within the NHS. But yeah, you've got your clinical and your non-clinical roles. So if you're thinking, well, I don't want to be a doctor, I don't want to look after, wounds and sick people, there's still lots of opportunity within the NHS. Next slide, please. I wanted to show this. I hope it's large enough for you to see. If it's not, I just wanted to explain. So this is a little boy. He's broke his leg. And now these are the different people that are involved in the care of that person. So he breaks his leg. He calls 999 using a bad way. So he's speaking to a call handler. A call handler is typically attached to like the ambulance service. So if you look at NWAS, Northwest Ambulance Service, you'll see call handler roles, and that's a way in to the ambulance service. If you think want to be a paramedic, you could come in as a call handler. Fantastic experience, gets you understanding what types of things patients need, and you're able to advise them. So you're learning there. But again, it's an entry-level career. Paramedic, come out to see you, can rescue you, take you to the hospital. You'll then see the receptionist, so one of those non-clinical roles. So you speak to the receptionist, then passed over to the radiographer, so they'll do the x-ray. So if you've ever broken a bone, it'll be the radiographer that does that. That whole area is generally called imaging. So radiographers that work within the, like I say, it's the imaging area. If you ever see them around hospital, they typically wear like a burgundy colour. Then you speak to the nurse as well. So you've been for your x-ray, you go back to the ward, the nurse is there to look after you. You'll make sure your checks and kind of observations, check you're doing okay. The doctor will come to see you, examine you, explain what the treatment options are going to be. Typically, you'll have a cast, so plaster technician. If it's a bad break, you might need some physiotherapy. So you might need to kind of do some exercises to get back on your feet. I've done physiotherapy myself. Typically, they'll give you some exercises to do. I'm kind of doing them as I'm here on the call now. But physiotherapist, you'll have a chat with those. If you're into sports, you'll know that your physiotherapists generally associated with like sports teams and things like that. Behind the scenes, we've also got the cleaner. Now, the cleaner isn't just brushing and mopping; they are decontaminating areas. They're making sure that areas are clinically safe areas. Obviously hospitals, we have lots of sick people now, though. If they've got an infectious disease or something, that can spread very quickly. So our cleaners are not just cleaners in the typical sense. They're very much like decontaminating, making sure that area is absolutely safe. Got the IT team behind that, so all these kind of electronic records or appointment times, managed by our IT team. NHS Digital, if you're interested in a career in IT, if you Google NHS Digital, you'll find a whole wealth of information there. And you've got the records team as well. So people who are looking after the records behind the scenes. These two teams, so the IT team and the records team, are kind of becoming more integrated now because we're getting digital, paper-based records. We're not seeing as much as that as we did once. Next slide, please, Ali. So the routes into the NHS, I wanted to explain, how you can get into the NHS. What is, a typical kind of way that you can get in, an entry route. So next slide, please. So yeah, after school, you could enter the NHS through an apprenticeship. So I'm sure you know about apprenticeships, but if you're not too sure what an apprenticeship is, it is a job where 80% of the time you're in work and 20% of the time you're spending off the job. You're learning, you're attending, I don't know, lectures, seminars, whatever that might be. So you're doing that kind of that book learning. So you're sat away from your job and you're learning that way, but you're getting paid all the while that you're doing it as well. So this is very appealing to people. To employers like me, it's really appealing that somebody has come in through this way because it shows that they've got the experience. So even if it's just basic things like working as part of a team, communication, speaking with patients, these are small things, but they're hugely important to us. T levels. So I work a lot around T levels. You can probably see that I'm a T level ambassador. So T levels is quite a new qualification. I think it first started in 2020, but it's a 2-year course, and you have a 45-day work placement. So most of the colleges in Greater Manchester offer T levels, but that 45 days gives you an insight into the world of work. If you're at high school, chances are you're thinking, I don't know what to expect work to be. It might be a terrifying place, it might be a really exciting place, I don't know. But this T-level course, it gives you that 45-day work experience. 80% of the time you're at college, so you're going to one of the local colleges, you're studying, you're doing your research, all the other things that come with it, the assignments, etc. But then that 45 days you're spending with an employer like us. There are other college courses, of course, so you've got BTECs and things like that. BTEC in health and social care. We see a lot of people use that to come into kind of nursing. Other courses such as digital as well. So, if you wanted to go the digital route and apply for a role in IT, digital. So yeah, it's well worth having a look at your local college and, the different courses they offer. University. So it may be that you do your, I don't know, say GCSEs, you do, I don't know, a T level or A levels, whatever, at college, and then you go to university. So you might want a degree, you might want a specific degree, and then you're going to come back to the NHS. So we have graduate programs. So once you've finished a degree, you can then apply for one of these graduate programs. You would typically have like a management graduates, so people who want to go into management roles in kind of non-clinical, like me. They want to go into those roles, they'll go to university and they'll go on to one of these graduate schemes. Starting a job and moving up. Don't discount this route, because it's one of those where you could apply for a role at a entry level. Maybe you come in as a cleaner or as a porter or as an admin assistant or something like that. All the while you're gaining the experience. People know that you're familiar with that organisation, so you're appealing to other NHS organisations. You're appealing to other departments because they understand that you understand how the NHS works, and you can work on qualifications. We have so much within our trusts, within our hospitals and our clinics to support education. It's really important that we have a knowledgeable workforce. It's not a nice to have, it's a need to have. We've got to have nurses who are up to date with the most cutting edge treatment methods, or we've got staff that need to be able to lift and handle patients safely. So we run courses regularly, and there's buildings dedicated to education. So I'm typically in Stepping Hill Hospital in Stockport, and there is a building at the front of the emergency department, and that is purely for education. It's classrooms. We have classrooms that are mocked up like wards. We have lecture theatres. Constantly things going on in there, and there's teams that support that. Next slide, please. So an apprenticeship, like I say, if you're not too sure what it is, you get the experience in the NHS. So you're working in the NHS, you're familiar with the way things are. You're earning a wage while you're training. Typically, an apprenticeship wage might not be what that final salary is. So if you were to be a fully qualified, I don't know, healthcare support worker, you would earn a certain amount of money. If you were an apprentice healthcare support worker, chances are you'd earn slightly less than that because you're not fully qualified, you're not there yet, but you're working towards it. gain a recognised qualification. So whether you stay in the NHS or whether you move on to something else, whether you go into a different area, you're going to get that recognised qualification and you're going to walk away with that. There's no debt involved. You don't have to pay that back. That is something that comes out of the apprenticeship levy. I'm not going to get into that, but there's no cost to an apprentice. You can progress to higher roles. So I've worked a lot with technical education, which apprenticeships fall under. Typically, you'll see somebody that work towards their apprenticeship. Once they finish that, they then move on to other things. Chances are it'll be a step up. It might be a sideways step into a different department with more opportunities. But yeah, those qualifications, they open doors for you in the future. Next slide, please. Work experience. I fully appreciate this is a really ugly slide with lots of going on, but I did want to kind of just illustrate that most of our trusts in Greater Manchester offer some level of work experience. So if you were to look at, I don't know, I mean, I'll highlight Stockport because it's straight in the centre there, Stockport NHS Foundation Trust. If you went onto the website and you looked under work experience, I think, I'm not sure which way around it is, but it's either in term time or outside of term time only. So there's terms and conditions to different trusts, but yeah, most of these trusts offer some level of work experience. So if you wanted a day, or an afternoon or a morning or something of work experience, or maybe a little bit longer, you can contact the trust, explain where you are, what you're studying, what you're interested in, and hopefully they could find you something. I worked at Manchester University NHS Foundation Trust, that's at the bottom there on the left. I worked there for a few years, and I don't think there was ever anybody that was turned down for work experience. They might have to wait, but yeah, it's a huge hospital. I think there's about 35,000 people that work there, which always makes me think of a football stadium. It's huge. But yeah, it's one of those where there is a dedicated email for work experience. So if you wanted to get some work experience, find out, do I really enjoy this, or actually, do I really not enjoy this? Because you might think, I want to be a doctor, I want to be a doctor, I want to be a doctor. But as soon as you're in a clinic or a ward, you might actually think, oh my God, this is not for me. I'm not cut out for this. And it might get you to think about something else. So even if you love it, fantastic. If you absolutely can't stand it, again, that's a really good thing with work experience, because it gets you closer to where you want to be, gets you to understand, what's the right career path. Next slide, please. I keep wanting to grab a drink of tea, but it's very quick. Volunteering. Volunteering, a little bit more than work experience because it's a longer term commitment. So this might be something that you register for, you register as a volunteer. So with the Royal Voluntary Service, the RVS, or become an NHS volunteer directly. And it is really useful. I think when I was younger, if somebody said about volunteering, I'd be thinking, no way, I'm not doing that because I'm not getting paid. But now I'm older, I kind of understand that I can volunteer in roles that maybe I couldn't apply for. I can access places that I can't immediately access at the moment. So by working, as a volunteer, it's a bit of a longer term commitment. It's a bit more casual. It's one of those where if you can only do, I don't know, Thursday afternoons, or you can only do Friday mornings, you can say that with the volunteering, because it's not a job. But it's a good way of getting experience and understanding. And especially if you're young, you come to write a CV, you've not got a whole lot to put on there, but you can put volunteering on there. There's lots of things that you can draw on, because I think when you are young, you've not had that work experience yet. Maybe you've not got a huge amount of qualifications because you're still young. But yeah, volunteering is really useful. One thing I've not put on here is Duke of Edinburgh. Duke of Edinburgh, again, really appeals to employers. So that's something that's kind of worth considering too. Next slide, please, Ollie. Applying for roles, I'm talking about careers, I'm talking about all these different educational routes, but you can apply for roles, especially, I mean, it depends on what age you are. I mean, if you're like 12, 11, 13, it's going to be a while down the road. So maybe consider some of the other options, but you can apply for entry-level roles. You could go on to NHS Jobs today, and you can set up a profile. Good thing about the profile is you can always use it as well. So if you come to apply for something and it doesn't work out, you can just use that same application the next time. You don't have to go back to square one. You don't have to start kind of, writing reams and reams of paper. NHS jobs is also really useful for kind of understanding, what do I need to be a physiotherapist? How much does a physiotherapist get paid? I'm not going to kind of, hide salaries. Salaries are important to a lot of us. But yeah, you can apply directly for roles. I would say go away, to NHS jobs, have a read, register, create a profile, especially if you're like 15, kind of coming up towards applying for jobs. It's one of those where if you just set that profile up, because if you see a job and you really need to apply for it really quickly, you can do, because you've already got that profile. So yeah, well worth having a look. Next slide, please, Ollie. Mention money, and yeah, money is important. It's important to know what sorts of salaries after all this kind of studying, and kind of, if you go to university, there'll be an amount of debt there with that. So it's important to understand, what it is. So some of these salaries that I've got up here. So like nurses, everybody knows nurses. Now, if you're a newly qualified registered nurse, you're typically a band 5. So we talk a lot about bands in the NHS. Band 5, if you can see it, is just over £32,000. Now, if you do that for 2 years, you would then progress to £34,500. It's really small on my screen. £34,500. But we have like consultant nurses or modern matrons or directors of nursing at the top end, which are around, I mean, if you look at 8A, the band 8A there, that's around £57,500. That could progress to £60,000, £65,000. So we've got from band 5 to band 8A, and there's lots in between as well. If you think about a ward, you might have somebody who's a supervisor or a manager of the ward. They run the shifts. They're typically around that £50,000 mark. So that's band 7. We don't have a band 1 anymore. It's been retired. But entry level posts are band 2 and band 3. If you're 16 and you're applying for roles and you're looking for entry level, band 2 is the entry level. That could be porters, but they can also rise to a band 4 depending on the responsibility or the kind of role. Healthcare support worker, again, that's another entry level post. That's the band 2. You're probably not going to make millions and millions working in the NHS, but the pension's really good. I mean, you might not be considering that at this point. We also have benefits such as the blue light card. Blue light card accesses a lot of different benefits, discounts. I think I've been to rugby and football matches for free, through blue light card. I typically get discounts at fashion places, if I need to. So yeah, the blue light card is, again, it's well worth having a look at. That's open to anybody who's in the emergency services. So yeah, paramedics, ambulance services, police. Pretty sure the armed forces are in there as well. But yeah, the benefits as well as the salary are something to consider. Next slide, please. Wanted to share this quote. In every role, try to be earning, learning, or ideally both. Your first job does not have to be a final job, but it should help you grow. I think definitely somebody starting out, that bit about your first job doesn't have to be a final job. You might get a job and it's entry level and you're not earning a huge amount of money. You might have a friend who's earning a lot more than you and you're thinking, oh, I'm doing all this work, I'm not getting anything out of it, but you're growing. You're getting that kind of you're getting that experience. It's going to open the next door for you. It's not your final job. It's not who you are. But it's one of those where don't discount that. Sometimes we talk about having the dirt under your fingernails. So you've had the experience, you've been there, and you've seen what it's like. But also, this is the first part. In every role, try to be earning, learning, or ideally both. So every job, you should either be earning lots of money, fantastic, that's great, or learning, or both. Both is a sweet spot. You're learning every day, you're stretching as a human, you've got fantastic opportunities, and you're also earning money as well. So that's ideally where you want to be. But yeah, don't discount those roles where it's really hard work, you're not earning a lot of money, but you're learning, you're getting a lot out of it for the next thing, whatever the next thing is. Next slide, please. Folks, we're in Greater Manchester, and hopefully you are too. But yeah, here is local colleges that that I work with. So in my role, getting people into healthcare careers, and these are local colleges that I work with. Hopefully, you look in there, and you go, they're down the road from me. But I would say have a look on their websites. You know, attend an open day, even if it's not something you're considering this year. Maybe it's something for next year. But have a look. Go down to the facilities. You'll have a look what they've got, how much money they've invested in these kind of areas. Just to highlight, Wigan and Lee College and Trafford and Stockport College, those places that I've been to relatively recently, they have these anatomage tables. They have classrooms that look exactly like wards. You know, they've put a lot of money into them, a lot of time into it. So the facilities are fantastic. They have kind of mannequins that have moving teeth and all sorts of stuff. They cost absolutely a lot of money. Yeah. So yeah, your local colleges are well worth having a look at. Like I say, it might not be this year, it might be next year, but go down, have a look at those facilities. Have a look at the careers that the courses that they offer. But yeah, well worth having a look. Just to highlight, in the middle is St John Rigby. It's just the others are quite clear who they are, but St John Rigby, it's a college in Wigan. Next slide, please. Other things, YouTube is really useful. So we have this NHS Health Careers channel on YouTube. Well worth having a look. You've got lots of insights and interviews and different things going on with people in those job roles. So they're telling you exactly what it's like to work in that role. You can find out so much information from that. So yeah, NHS Health Careers, well worth having a look at. Manchester is hosting the National Health Careers Conference in September there. So yeah, September the 19th. It's a Saturday. I was a part of this last year. It's absolutely fantastic. The people behind it, the amount of kind of time, money, effort they put into it is fantastic. The people that they bring together in that room. If you're considering a career in healthcare, fantastic. Go and have a chat, make some connections, potentially get yourself some work experience or whatever it might be. But yeah, it's well worth getting down to. You don't have to be there for the full day. It could be that you just dip in and out of sessions. But yeah, well worth having a look at. There is a tiny QR code. If you've got your phone, fantastic. I'm assuming you probably don't have phones with you. But yeah, if you Google it, Health Careers Live, you'll be able to register for that. If you can't attend in person, they offer a digital kind of pass as well. It's free to attend. You can bring parents as well, so you don't have to go on your own or go with your friends. Like I say, I was there last year. It was absolutely fantastic. There was loads going on, really useful things as well. It wasn't just information. It was practical skills, things like interview skills. So if you think about a job interview, you might think, oh my God, that's terrifying. Well, there was a workshop on things like that, creating portfolios, presenting yourself, your CV. There was lots of work on things like that. But yeah, venue's not been announced yet, but I would say register for that. It's really useful. Next slide, please. And finally, I've got some homework for you. I'm not going to be marking it, so it's up to you if you do it or you don't. But yeah, the Health Careers website, we have got a careers quiz on there. Really useful because it gives you an idea of what you really like doing. It might point you towards certain things you've never considered before. It might give you a term or a name of a role, and you think, oh, I'm going to go away and find out a bit more about that. Contact your local NHS about work experience. Like I say, most places in Greater Manchester offer work experience of some description. I would say, register for the work experience, get some work experience, whether you enjoy it or you don't, it's going to be valuable. Set up a profile on NHS Jobs. If you're looking to apply for a role, please, do set up a profile on NHS Jobs. If you're kind of close to it, you can at least, explore the types of roles that we have in the NHS. Have a chat with somebody in health and social care. It might be that you know somebody and you're thinking, well, I'd like to know what it's really like, but no, really, what's it like? You want to get that kind of that truth, the insight into a role. Have a chat with somebody. They're always happy to help. Local colleges and courses, again, if you're looking at it for this year, please, go on those open days, go and find out more, chat to your friends, whoever it might be. And then lastly, register for Health Careers Live. So there's a lot there to go at. Hopefully these are really practical, useful things that you can get your teeth into. But yeah, that is me. So thanks a lot for listening, folks. Really appreciate it.
Amazing. Martin, thank you so much for your insight and your input there. Just to reiterate, Health Careers Live 2026, it is on a Saturday, 19th of September, I believe, Martin. Just give me a nod. Yeah, fantastic. Make sure you get yourselves there. I think it's a fantastic opportunity. You never know, you might have parents and carers or older brothers and sisters or cousins, whoever it may be at home as well, that's looking for the next opportunity. That can be a fantastic place to explore how you can be part of the ever-growing and ever innovative health and social care sector. The information that Martin's given today is a key piece of your careers education, and it's key to making sure that you have the most informed decision-making ability when it comes to looking at your post-16 journey. Should you want to take that a little bit further, should you want to do more homework like Martin's mentioned there, should you want to learn about other sectors as well, I'd encourage you to go and sign up and have a look at the GMAX website. So the GMAX website is the Greater Manchester Apprenticeship and Career Service website, and it was designed by us at Greater Manchester. The main ambition of that website is to help you plan for your future. So looking at what courses, what skills, what career opportunities are available for you. It's packed with advice, tips and information. Next slide, please, Ollie. Within that as well, so we've got Beeline. So Beeline is going through a fantastic development at the moment. We can't wait to share those developments with you. This supports with the GMAX website as well. So where we've got an ambition to give you a clear line of sight, Beeline will paint that journey for you, and it will support you with that as well. The final key piece of messaging that I will sort of leave you on this morning, because I know it's a Friday morning, we're all eager to finish for the week as well and to get started with the last day, is check out the YouTube page as well. So we've got a YouTube and an Instagram page. You can check out, it's like GMAX YouTube page. We've got plenty of other sessions like this available, so if you want to find out and hear from more employers, learn about digital and technology, construction and careers, you want to learn about engineering and manufacturing, we've got plenty of different resources on there as well. I'm sure you'll all join me in saying a massive thank you to Martin as well. So Martin, thank you so much for taking your time this morning supporting with this conversation. I'm going to end the session there, but I look forward to seeing you all onto the last session of the year next week, and have a fantastic weekend and the remainder of your week. Cheers.